I wasn't able to get to all of them, but I'm sure you've come back inspired by the conversations and ideas discussed in the breakout sessions. Importantly, and this is a big part of it, I heard there was a lot of great connections made between people with different ideas, different organizations, different parts of the state. So I think in that way, that's already been successful. We will certainly be focused on gathering up the ideas and discussions and hopefully some consensus ideas from the facilitators and the experts and the note takers. And then my goal would be to put that into a report summarizing. So hopefully, not everybody's going to agree on everything, but I think what we want to do is be respectful of the fact that we have so many people who volunteered today who wanted to help us put together this summit, and the breakout sessions were a key part of that. So we have now come to the stage in the program today. We're upon our final session. And I think that it's actually, in my view, we've obviously had some great speakers and great advocates, but to me, this is probably the most important session. And we designed it to be the session that ends the summit with a sense of hope. And that was certainly one of the goals that we wanted to have here. So the next panel is meant to show that there are many successful pathways of treatment on the journey of recovery, and many of those successes and programs are happening right here in the Mat-Su Valley. You all know, and I think one theme that we've certainly heard today is recovery is certainly not a one-size-fits-all program. Recovery looks different for everyone. And today we have a panel that I think is going to demonstrate that. So what we're going to do, similar to the session with the Surgeon General, is we're going to have our panelists, our experts, we have a number of them, in a session that will once again be moderated by Dr. Jay Butler, Alaska's Surgeon General, and then, of course, take questions from the audience for our panelists. So I'd like to invite the panelists up today for this discussion, and I'm just going to name who's here in the organization, and then you're going to hear about more of what they're doing. So Philip Lick with Set Free Alaska, Carl Soderstrom with Fiend to Clean, who I had a great meeting with in D.C. a couple months ago. Shalise Jorgensen with the Sunshine Community Health Center. And Cece Schoenberger, who's also with Sunshine. April Kyle with South Central Foundation. Dr. Michael Alcorn, who's retired from the Air Force, and he's with the Chris Kyle Patriots Hospital. And once again, Alaska's Surgeon General, Dr. Jay Butler.
Thank you, Senator Sullivan. I'm going to see if this walk-around mic does work, so that's good. So we have a panel of hope dealers with us today. So I'm really pleased to be able to moderate this discussion. And the perspective that I bring to this as a clinician as well as a public health professional is my clinical background is in infectious diseases, and 2 years ago I was taking care of a number of patients with hepatitis C, many of whom acquired hepatitis C through self-injection drug use, and some of my patients were still active users. And I really loved that part of my job because, first of all, we had just coming out a cure for hepatitis C. And, I'm of that age that I was just going through my training during the times when HIV was emerging, and that was hard. And I remember in the 90s being able to talk about a new drug that we thought could control the infection. But with hepatitis C, it was really a rush to be able to say, we can cure this now. and having some patients say to me, you know, I've recovered from my heroin use. This is going to complete my recovery. But I had other patients who still weren't in that phase of recovery from their opioid use. And one of the things that I always found really exciting is when someone would basically identify themselves as recovery ready. And so that's where our panel is here. And as the senator said, there are a number of pathways to recovery. So the question I'd like to pose to the panel, and just go down the line and answer that question, is tell us about how you provide care to someone who is recovery ready. I'll turn it over to our panel. Whoever would like to go first. You're on the end, so you're by default.
I guess that'll be me. I'm Dr. Alcorn. I'm from the Chris Kyle Patriot Hospital, which is the newest addition to North Star in Anchorage. We've been open for about 14 months, and we treat both active duty members as well as veterans. We provide treatment for both trauma as well as substance use conditions, and we do both detoxification as well as rehabilitation services. I kind of look at what we do as kind of the first step towards recovery. We are a voluntary facility, so for the most part, we usually assume that that means that patients are at the point where they are wanting to get serious about their recovery. When the patients come to us, we have an intake department that does the initial screen, gets the basic background information, verifies that the patients are appropriate. And when they come into the facility, then we kind of like to do a full evaluation of the patient, regardless of what they come with, what their primary complaint is. They get a thorough psychiatric evaluation. They're seen by a therapist who does a thorough psychosocial assessment, basically kind of taking stock of everything that may be going on in the patient's life. Most of the time, the patient will have a neuropsychological evaluation just to determine what strengths and weaknesses may be there to kind of help guide treatment. And then basically the treatment team kind of puts a plan together for the patient. Again, some patients come in requiring detoxification before they can start the treatment tracks. Some patients come in already ready to go straight into the substance rehabilitation track. And again, if patients have issues with both substance use as well as trauma or mood conditions, then they actually do some of their programming in both tracks. There's a variety of programming that goes on while the patients are there. It's largely, a lot of it is built off the 12-step model, but they receive programming in different areas to try and help them kind of become a more whole individual. And then, of course, discharge planning occurs the whole time that they're there. We have a liaison that works with the military, with the VA, and of course, discharge planning is very important because we know that recovery goes on once they leave the hospital. And so we try and make sure that we plug them into what's going to be the most appropriate discharge setting for them.
Thank you. So April, South Central Foundation.
April Kyle, I'm the Vice President of Behavioral Services, South Central, and I have just a couple minutes to share a quick story. I think those of you who know SCF know we're about the idea that each of us has multidimensional wellness, and that includes physical, emotional, spiritual, mental, behavioral health in our person and in our family at all times. And we try to design our services recognizing that. And a couple of years ago, I was taking one of my sons to an appointment for strep throat. And he was in the back of the minivan, and he said, "Mom, when we get there, can we ask to see the BHC?" He was about 7 at the time. And he knows what a behavioral health consultant is. And he knew it because he's always had a behavioral health consultant. He's never known differently than having a behaviorist on his primary care team, because primary care needs to not forget that physical isn't what's primary, that it's a balance, and all of those things are primary. And I said, "Why do you want to see a BHC? And he said, "Mom, kids are having sleepovers and I don't want to wear a pull-up." Someday he won't want me telling that story anymore, but he's still little. And I love him. Our idea is to have a healthcare system where our primary care teams are in relationships with the families that they partner with, and that is a journey over time, and that relationship with behavioral health is not, some people need behavioral health in a building over there, or sometimes those people do, but that this is us and we need it, and it needs to be part of our delivery of care. And I want to share with you just one other story. It will be very quick. I was at a graduation for our outpatient treatment program a couple of weeks ago, and the graduates were sharing to the group, and I was in the back. And you know that moment where you can feel the tears start to well up a little bit? And I was just inspired by the strength, by the courage. I just found those graduates to be inspirational. And so if I want to talk about what it takes to be recovery ready, my comment is all of this that I feel in this room, this inspiration of how hopeful recovery is and how much success there is, I'd like that to be shared by all Alaskans and to figure out how to move from that feeling here to that feeling for all of us as a community.
Thank you, April. The Sunshine Clinic.
I'm Cece Schoenberger, and I'm one of the behavioral health providers at Sunshine Community Health Center, which is a small community health center up in Talkeetna. So we have clinics in Talkeetna and Willow. So we are kind of out of the mainstream of where services are. So we've had to develop some services that are specific to our population. So about 7 years ago, we started a program that uses medication-assisted treatment. We use Suboxone, which is a fully integrated, as April was just talking about, that we're treating the whole person. So all of our program combines a team. It was just a team of the medical doctor and myself, the behavioral health provider. We have been able to get additional funding through substance abuse expansion grant, and now we've got a much larger team, and so we've been able to add case management to it. So when a person comes to us for treatment and they are recovery ready, they may not know that they're actually recovery ready. They are looking to stop. They want to not be hurting. They want to not be getting Suboxone off the street. They want to be living in a, what they say, normal life. So they come in and we treat them, and it's a very prescribed treatment. It's certainly a very low level intensity treatment. Sometimes it's not enough for some of the folks, but many of our folks have done really well. And you know, we've had a research study that studied our program, and what some of the patients talked about in terms of recovery, certainly no use, but also that they were functioning in life. They had jobs. Many of our folks have gone back to work. They no longer have, they're no longer in the criminal system. They are earning money. They are they're raising families. Many of our folks have had more children, gotten married. They're going to college. We had a student who was dyslexic, who was functionally illiterate, and he's very far along towards his degree. So this is what they describe. This is what they want, and we hopefully are trying to provide that for them. But we absolutely strongly believe that it is not the medication alone. That certainly helps. It has to be combined with the behavioral health treatment. Without that, it's really not full recovery from our point of view. So we are really hoping that when people are ready to leave our program, and some are in for very long-term maintenance, they are feeling like they are a recovering person who is living a full life.
I'll just add really briefly that I think the other thing we're doing really well is trying to make sure that an opportunity is available for anyone who walks in our doors, and that's an incredibly powerful piece for primary care.
Hey everybody, my name is Carl and I'm a person in long-term recovery. Yeah. So what that means for me is today I get to be a friend. I get to be a husband to a beautiful wife who's never had to see me use. And it's also her birthday, so happy birthday, babe. And I get to be a friend, and I get to be an employee, and I even get to be a best friend to that guy, Kirby. So about a year ago, Kirby and I were conversating, and I got to really say that it was his passion that really started, Fiend Too Clean and what that is. And really what it is a couple of guys who are in recovery and sick of seeing other people hurting. These are our friends. These are our family members. These are our coworkers. These are the people that we see every day, and there's a lot of pain going around. And we were tired of it, and we wanted to see some love going around. So we decided to spread some love, and what that looked like was just making a bunch of noise and sharing the message of hope and talking about addiction recovery and trying to change the stigma around the way that the community sees addicts. A short story, I got a flat tire. I'm sure a lot of you guys have had flat tires, right? And I'm from the East Coast. I'm a transplant, and it was wintertime, and I'm like, crap! Within 20 minutes, 5 people pulled over and asked, "Are you okay? Can I help you? What's going on? Do you have another tire? Like, I'll totally help you with this problem you have." That's the Alaska that I came to know and love, and that's the Alaska that we need to extend to addiction recovery, right? So briefly, when somebody says, "I'm ready for help," we answer the phone. Literally, we bought a cell phone, and we got them to make the number 907-982-HOPE, and we answer it when people call. And we talk to them, and we've also went out and talked to all the providers that we possibly can get an audience with, and we tell them, hey, when people call us, we want to be able to tell them about you. And we get them connected, and we love on them, and we spend time with these people and hear their stories. And when people are hurting, a lot of times they just don't want to be alone. And sometimes that's what we get to offer is just an ear and some compassion, and to tell them that they have value and they have hope, and that I've been there, and that we can get through this together. And we try and guide them, literally hand in hand sometimes, to our clinical providers. We know that it's a really small window, so all we really have to do is be available and be willing to collaborate with others. And we've been successful doing it this far, and it's been a pleasure. And thank you for the opportunity for being up here.
Thank you for being here.
Good afternoon. My name is Philip Licht. I'm with Set Free Alaska. A couple weeks ago, Carl and I were at an event together. They had a table. They've got all this amazing shirts and bracelets, and I have an 8-year-old. He went around to all the tables and got all the swag he could get his hands on, and he had a bag of goodies. So we got home that night, and we were looking at his stuff, and we noticed he had a black bracelet on his wrist, and my wife, Cheryl, and I said, "What's that?" And he said, "Oh, this is my bracelet I got," and it said on it, "Sober is the new sexy." So I thought, no, they're getting the message out, right? Sober is the new sexy. My 8-year-old is trumpeting the message for you guys. So, love what you guys are doing. The message of recovery, the message of hope. 2003 was the first year that drugs or alcohol didn't enter my body since I was in 4th grade. And so I'm so thankful to be here with you today. A couple years ago, I met a young lady. She came to our program. She had been in an alcoholic and a really severely abusive home. She had, at a very young age, began to learn how to cope with that through her own addiction. And she was in very dangerous, abusive relationships, domestic violence throughout her life. Lost her children to the Office of Children's Services, and came through our doors very angry, very bitter, very broken. I was just with her in an event 2 weeks ago, and we were speaking together, and she testified that she now is sober for 2.5 years. She's got her children back, she has a job, and she is so overflowing with life and hope because of the truth and because of the support that she received through many, our agency, Set Free Alaska, being one of those. She told a story about when she was a child, her mom would brush her hair and would rip the rats out of her hair and say, "You need to suffer to be beautiful." And she took that belief system into her relationships, thinking that because she had such a low value and worth that it was okay for people to abuse her, and that it was okay the things that were happening to her. And as she told this story, she spoke of the truth of learning in our program that she had great value and great worth, and not because of anything that she's done, good or bad, but because of who she is as a person, and because there is a God who loves her, that knit and formed her together in her mother's womb, that numbered every hair on her head. And because of that value and that worth that she began to feel in her life and believe, it shattered that lie that she had believed. And there's really no better way that I can describe the philosophy of our program and the pathway to success and recovery that we're using in our approach, is that every person who comes through our door has an incredible value. And our love for them and our coming alongside of them and telling them that you're not identified based on what you've done. You're identified based on who that you are. And not only is there a God out there that loves you, but we love you. And we're here to walk through this with you. We're here to support you through this. And that is really the foundation and the core of all that we do. We offer what we call a mind, body, spirit approach to recovery. So we're not just plucking the fruit off of the tree. We're dealing with those issues under the surface and those root issues, those belief systems, those identity pieces, that are those traumas that are leading to that behavior. And we're trying to correct those wrong ways of thinking to get people to believe that they have value enough to live a healthy, productive life where they can thrive in this community. There's practical ways we go about doing that. We don't just bring them in and say, hey, we love you, and just, sure you'll be better now. We offer outpatient services, and the combination of our spiritual and evidence-based approach is to say we believe that there is wisdom in the evidence-based modalities and methodologies, and we're using those methodologies in our program, but we're combining them together with the spiritual principles so that we can see and serve the whole person. Currently, we have outpatient services for adults and teens, so people are coming anywhere from 1 to 5 times a week, and I'll mention a little bit later where we're going and how we're trying to bring improvement to some gaps we see in the community as well.
Thank you, Philip. I think one of the things that become apparent today that there are a number of things that can be done. They're not easy. If this were easy, we would have done it a long time ago. Addictions are a challenge that have been with us for decades. In some ways, it feels funny that we're having this discussion now, but it is a time of crisis, and it's a discussion that we can talk about how it should have happened before, but we're having it now. So let's take advantage of that. It's easy to start wringing our hands. It's easy to start pointing fingers, but I think what we need to do is really join hands on this. So sort of building on that basis of what do we do to help people who are individually recovery ready, I'd like to pose the next question as a toss-up for the panel and for everyone is, what can I do, what can you do, what can everyone in this room do to help make Alaska a recovery-ready state?
Well, I'll start with that. It was mentioned actually earlier by the Surgeon General, prevention. So often we have viewed prevention and recovery or treatment as two completely different animals. And I really believe that they're so important that we combine them together, that we realize treatment is in itself prevention. It's very, very difficult to prevent substance abuse in the next generation when by the time they get to elementary school, they've had 4 to 10 ACEs because of the environment of their home. So when we treat mom and dad and create a culture and environment in that home which is safe, we are bringing about prevention. And so the emphasis and the funding towards treatment only and not as much towards prevention needs to change. And one of the things that we're doing here in our community, thanks to some support from the Matsu Health Foundation, this fall we're launching a mild to severe behavioral health program for children. And so what we're going to be doing is freedom from addiction. Thank you, Kara. Freedom from addiction by the means of loving these children, helping them process the trauma before they ever even get to the place of addiction. We're preventing and intervening early. These children have such incredible value. And the other thing that I'll say, I'm 100% in support of the advocacy and efforts towards detox, but I also have a concern that if we put effort and energy into detox without providing support service around detox, such as the Feed to Clean and the peer support and residential treatment service, we could actually see an unintended consequence of getting someone through detox and then releasing them out of detox without having somewhere to put them. We need residential beds. And so this next year, I was also happy Senator Murkowski mentioned her focus on women and residential beds. And so we're going to be launching a residential program for women and pregnant women, using a combination of medically assisted treatment and a spiritual program, combining those two together and seeing something we believe to be very effective. So we've got to advocate not just for detox, but for support, peer support, for residential, so that there's, 10 days of detox is not going to take someone through long-term recovery. We need to have good, strong support in place for them when they get out of detox. So there's got to be a coupled approach.
I love everything everyone is saying. I love that there's a phone number that if you call, we will answer it. I love that you want to serve every person who comes in, and I appreciate your comments about detox. And my summary of that is we have to have the right supply of us doing this work for the demand of our community. We just have to. We have to evaluate that, and we have to work together as partners, as a network of services to identify from a population level what is the need and where are the gaps. Because I agree with you, detox is not a solution. It's a part of a bigger picture, and all of the parts. So many successes I've heard about, so many programs today, but all of those parts and how they fit together and how we make sure that we have enough of them with enough variety so that people can have choice and can choose something that they can get on board about, and that we have to do it together.
So I would say first of all, my thought is what we're doing today is very important, and we need more of this. I think that the only way that we really do start hitting this problem in a very big way is to have collaboration, multi-agency, lots of partnerships, lots of talking to one another, and then decreasing the stigma for people who experience addictions, for people trying to treat addictions as well. It's only through conversation on multiple levels that we do that. The other thing I would note is just it would be helpful if we decrease some of the regulatory barriers. As a community health center in an area where we are the only behavioral health provider for about 12,000 square miles, and we have to go through hoops and hoops to even provide service outside of our doors. It makes it really difficult. We're trying to have impact in the building, and we're trying to touch our children and in ways that decrease trauma and increase resiliency, and try to pay for those services. It's really difficult. So there's lots of regulatory pieces that I think could come together to really help support all of these efforts much better. Thank you.
So how do we get to Recovery Ready Alaska? We recognize this as a movement, right? We're not there yet, but we are well on our way, and I want to share that with you. So I'm going to stand up, and I'm going to ask that if you're in recovery, if you'll stand with me. This is how we get to Recovery Ready Alaska. We know that we have a voice, and we share it with people. And we love on people, right? Because, yeah, we got to change policy, but public policy is driven by public opinion. So we got to stop acting the way that we're acting. We got to love people the way that we want to be loved, and we share our voice with people. You know, it's not about dollars. We haven't gotten any of those, and it doesn't matter because we're effective. What really matters is digging down deep and knowing that, like, there's people in our lives that are affected by this. And if we look at them and then look at it at a macro level, every one of us is touched by it. You know, so we continue to share hope, we collaborate, and we use our voice, and we grow that momentum so that there are people that say, I'm ready for help, and they're not afraid anymore. And then there's people that can answer the phone, and then we can send them to people that can give them the help that they need. That's to me what Recovery Ready Alaska looks like. Anybody else?
I've loved everything everybody up here has said, and I couldn't agree more with all of this. And just the one piece I would add is for those of us that work in the field, for those of us who are recovering ourselves, just trying to spread your enthusiasm to other people and looking for things that need to be improved in the community and not being afraid to try and take the steps necessary to find a solution to those problems. Personally, I was stationed up here with the Air Force from 2010 to 2015, and having come from California, from Los Angeles, you know, there were abundance of services. So being in Anchorage, a fairly large city, and working in the drug and alcohol program for the Air Force and finding out that we would frequently have to send patients to Texas or Montana or places that far away just to get more intensive residential treatment just was not something that I felt was good for the patients. I had the fortune when I started to do some work with North Star, seeing kids, which is also one of my specialties. You know, I had a chance to talk with the CEO who said he wanted to do something for military and veterans and wanted to know what would be the most helpful. And at that time, I felt like it would be something more longer term. Like Carl was saying, detox alone is not enough. And so kind of providing input, connecting North Star with providers on base, we put together a program for the trauma and substance abuse on a longer term treatment model. And so now patients are able to be admitted there. They're able to participate in their treatment, and family or friends or whoever's going to be their source of support in the community is able to come and able to participate and meet with the patient and with the therapist. And as part of our mission, we try and provide outreach to try and find other providers who share an interest in this field. So that's what I would say is we do need more. We need more providers. We need more, obviously, funds, but just more kind of enthusiasm in general, more interest in helping to take care of this population that a lot of times does not get the attention that they need.
Thank you. Philip, back to you. This does not mean we're going to go down the panel again, but
One thing I want to mention, there was a man, William Wilberforce, who was the MP who was instrumental in the abolition of the slave trade. He said that public persuasion is necessary for societal transformation. And part of the shift of public perception is that there is hope. If you get anything out of today, the stories and the message of hope that people do enter recovery. And our stories are incredibly powerful because there are people out there who don't think the money is worth it, that they don't tie the individual life and the story with the money and the resources that are being put forth. And it's so important that we collectively share our story and that we begin to trumpet a message that recovery is possible and that lives are worth the resources to put forth into recovery. And so I want to encourage you, because it can't just happen on a public policy level. It needs to happen also through public persuasion and through a grassroots effort of people stepping up and standing up and saying, yes, we can do this. This does happen. People do change. A few years ago, we had a senator at our event, a state senator, and he came up after me, talked to me, and he said, this is the first time I've ever heard a story of someone who is addicted to meth who was in recovery. long term. It was very, very powerful for him because he heard a story about a life that was changed, and he was able to take that back and realize, okay, these decisions we're making are making a difference down here in Juneau.
Thank you. So as we move towards wrapping up, I mean, I heard 4 really important issues there. One is prevention. That's a discussion we have to have. Another is remove the stigma and begin to address addiction as what it is and to remove the shame. A third issue that I heard was, if I can paraphrase a little bit, speak truth to power, because people need to hear the story, which is really the 4th point I got, is recovery is a story that has to be told, because many of us don't see it if we haven't experienced it ourselves. And my eyes have been open to the fact that recovery is all around me. And I really appreciate the people who have educated me on that and helped me begin to see that. And I think that's something we need to do for all of Alaska. So before we invite the senator back, okay, I wanted to take a couple minutes to pose that question to the audience as well. What do we, all of us in this room, what can we do to make Alaska a recovery-ready state? There we go. If somebody has any microphones.
I'm pretty loud. So I just kind of wanted to, first of all, say thank you, to everybody in here. I think everything that's been said is something that's beneficial to our community and to our state. I think one thing also which I heard and just kind of want to say again is educating the community. What does recovery ready look like? A lot of times you'll say, let's be recovery ready, and to some people that is, you're in recovery and that's it. But some people's journey includes relapse. Like some people's journey, it takes a relapse for them to become recovery ready. So I think just educating the community, educating the state on what recovery looks like and that it's different for everybody through all the resources that we've talked about having.
And I missed the opportunity to try to best the Surgeon General to not only jump down off the stage, but then run to the back of the auditorium. And we have time for one more in the back row. Ooh, let's do 2 more then. How about back row and Representative Sponholz? Oh, is that, I hope I...
I'm not Representative Sponholz.
Oh, okay, I'm
She's
sorry.
awesome.
The light is in my
I
eyes.
wish that I were. She's amazing. My name's Tiffany Hall. I'm with Recover Alaska, and just thank you all so much. It's been an awesome day. But one thing that I think that everyone can do, sometimes people, if you're not in recovery yourself, or if you are not a provider of services, then maybe it's harder to know how to do something. But we all have people in our lives who are affected by this. And people ask me often, oh, I think my coworker might have a problem, but I don't know if it's my position to say something, and I don't know what to say. So say something. I think that if you notice an issue with somebody in your life, whether it's a manager or an employee or a brother or a sister or a parent or a child, say something, because you might be the voice that they need to help them recognize they have a problem, to help them get help, because maybe they don't know what to do either and they're in the middle of this struggle. So it's difficult, it's a hard conversation, and maybe it won't go very well, and maybe that won't be when they're ready for recovery yet. Maybe they'll need 5 other people to say it too, but say something. It's on all of us. Thank you.
Thank you. And then in the back row here will be our final comment, and then I will turn it back over to Senator Sullivan.
Up until recently, when someone came into the emergency department to see me and they needed help, I had no idea where to send them. And I used to tell them there's hardly any services here in Alaska. I knew about the Ernie Turner Center and that's it. But there's so much more. I just didn't know about it. And over the last month or so, we have developed a list. In this age of communications, There's no list. And there are so many people in this room representing so many agencies who are so willing to help. There's lots of resources out there. And one thing that really needs to come out of this summit is an organization of the organizations so that everybody knows what's out there and what other people are doing, because that's how we collaborate. So that's really simple, yet really important. And now there's a big poster up in my emergency department with everything that's available, with a wonderful social worker who now has the resources that she needs for the individual patients when they come in. Simple and effective.
Thank you. So I'd like everyone to join me in thanking our panel. And thank you, Senator Sullivan, for putting this together. I'll turn it back over to you.
Well, thank you, Dr. Butler and Philip, Carl, Shalise, Cece, April, Michael. Thank you. It takes a lot of courage to get up and talk about what you've been focused on. I think it's not only experts, but a great example of hope. And so I just want to wrap up here. First by thanking everybody for coming. Those of you who've been watching online, thank you for tuning in. I think we've had great examples, great ideas. I want to thank the Mat-Su College again, Kinnick Tribal Council, the Chickaloon Tribe, who's also been importantly involved in this conversation. And, you know, you've heard from a lot of people today. We've heard from a lot of people today. And the idea of being Alaska Recovery Ready is critical. And Senator Murkowski and Congressman Young and I are certainly motivated to go back with a lot of the ideas that we gained here and to keep working together with everybody. We can make progress, even in DC, believe it or not. And you know, as I mentioned at the outset, Kara and everybody else who came to see me last fall, they were pressing. They had ideas, right? And one of them was the aptly named Kara Bill. And that passed. And as I mentioned that earlier, but that's Democrats and Republicans coming together. So it's progress. It's not, you know, a home run, but it's a single. And we got to start with those. So just, you know, when we started here today, I mentioned that the goals of the summit would be really, the way I saw it, 4 goals: to educate and listen, to engage with each other and make connections with each other, to paint a picture for all of our federal officials. I'm so honored that our federal officials from the VA are still here, still engaging, and I think whether it was the Surgeon General or the Deputy Secretary of HHS, that they got a sense of our uniqueness, our challenges. I think that's so important, to leave the sense that you're not alone if you're struggling here with these challenges, that people care, that people are trying to understand, and that the stigma that has been talked about should be lessened. And then, of course, as we mentioned just in this panel, a sense of hope. What are the pathways? And I hope we were able to meet some of these goals, but here's the truth in my mind. If just one person who attended this summit decided to seek treatment, or now feels brave enough to speak openly with their family about addiction, or has learned more about this epidemic, then today's summit has been a success. If it's just one. So I want to close by focusing on what I think has been kind of the underlying theme throughout the entire day today, and that's the idea of community. Now, I just recently finished reading this book. It's called Dreamland, The True Tale of America's Opiate Epidemic. Just came out, winner of a bunch of awards already. and I highly recommend it for people who are interested in this topic. But be warned, it's very painful to read, it's sad, it's very scary to read, because this guy's become an expert, and he digs into things and what's happening, and it's just shocking. So it's scary. And what's clear to me and tragic after reading this book is that some communities in America, when you read this, you'll see, have literally been utterly destroyed and torn apart and devastated by the opioid heroin addiction challenge and the darkness and the crime and the lack of hope that comes with it. You read this book, you'll shudder at what has happened to certain communities in America. Now, I don't think, and I certainly hope you don't think, that that kind of total destruction has happened in communities in Alaska. But let's not kid ourselves. It could, because it's happened in other great communities. So I think one goal as we're leaving here is to keep in mind the importance of all of us coming together to make sure those kind of things don't happen here, that they don't happen here. When you read about them, that you don't want these horrible things to happen here, even though we definitely have challenges. So hope and community action are the key. And what was really great about having the Surgeon General and others up here is that, we have a lot of that in Alaska. And it's not just us saying it to each other, the people who live here. You have the top official in the country who's been in Alaska for 72 hours, and how many times did he say that he saw Alaskans as strong and resilient people? That's from the Surgeon General. So the final page of this book, the last page of this book, talks about a lot of these issues: community action, resilience, strength. So what I thought I would do, without ruining the book for those of you who are going to read it, is just quoting from it. This is the last page of the book. And I just thought this guy knows probably more about this problem than anyone else, the author. And here's how he ends it. And I just wanted you to hear it. I believe more strongly than ever, the antidote to heroin is community. If you want to keep kids off heroin and opioids, make sure people in your neighborhood do things together, in public. Form your own dreamland and break down those barriers that keep people isolated. We're Americans. We don't just sit around and take the beating. We act like Americans have always acted. Heroin is fearsome enough to force us to action. What it does to users, their families, their neighborhoods is so harrowing that heroin reminds those who live through it of the ties that bind them to others, producing in some places the opposite of the isolation that produces in users. So that's the last page of this book. So yes, we're Americans, we're Alaskans, and so many people here are examples of driving these community solutions that are going to be so critical to getting us through this. And I hope that this summit has helped to advance some of these goals. So thank you very much. Thank you.